Thank you everyone for joining today. We are excited to have the second part of our Maintain Your Brain series going off today. Today is the topic of the 10 warning signs of Alzheimer's, and it's going to be presented today by Cynthia Perthuis, and she does a fantastic job with all of her training and her workshops, so please feel free to ask her as many questions as you can. She is a certified dementia practitioner and teacher. I just took her class, so thank you very much for that. And she has a tremendous background within Alzheimer's and dementia, so it's a great opportunity to be able to ask her questions, and she'll let you know in what format she wants to. So welcome, Cynthia. Thank you for joining us today.
Thank you. Thanks so much, Felicia. And thanks for everybody who's joining us today. So let me just give you a very quick, brief background. Thanks for joining us here at the Arlington. I'm sorry that we can't all be at the Arlington and see what a great place the Arlington is. It's one of my favorites. But what I do, and the reason I do it, is I have my father died with Alzheimer's, and my mother had Parkinson's and Parkinson's-related dementia. And so I just know that disease of dementias is running around in my family somewhere and is out to get me if I don't run faster than it does. So I've done a lot of training around dementia, and I'm a dementia specialist, but I am also a community educator for the Alzheimer's Association. And so today I'm going to go through the 10 warning signs of Alzheimer's. And I want everybody to just put their thinking caps on, open up their eyes and ears, and we're going to go through some things and show you the warning signs. And we're going to talk about the differences between Alzheimer's and some warning signs for Alzheimer's and just some plain old, we're getting old and our brain's getting old and tired. So we'll get started. Let me go and get my video up for you. And this is a multimedia presentation, so we're going to get to have, we are going to get to have some videos, and let's see where we are here. There we go. So as I mentioned earlier, this program is for those of you who want to learn more about the warning signs of Alzheimer's and of other dementias. And for those of you also, maybe you've noticed some memory or thinking changes in yourselves, or you've noticed some memory and thinking changes in others. And so we want to help you put your mind at ease or open your eyes to things that maybe you should be looking at. So think about what you want to learn today, and make sure that if you have questions that you put them into the chat, or we'll talk at the end, and we will see if we can help you answer those questions. And I'm sure that between the people who are here on this call, we will have some of the answers for you. So as I mentioned, today, we're going to explore the most common warning signs of Alzheimer's. And we want to help you be informed about what is normal aging and what is not normal aging. By the end of today's program, our goal is that you're able to describe these typical age-related memory, thinking, or behavior changes, but you're also able to recognize the common warning signs of Alzheimer's and other dementias. We're going to talk about some tips and tricks for approaching someone that you know or that you love that has memory concerns. And we're going to explain the importance of early detection and the benefits of that diagnosis, an early diagnosis. We also want to show you some tests and assessments during that diagnostic process. And then we at the end, we want to wrap this up with giving you some resources besides the Arlington that can help you with these things that you may discover today. And to do that, we're going to have this fictional family. And this fictional family was prepared in this slide presentation probably months ago, before anybody but me. But this family looks very much like my family. And so I'm going to go through. Now, this family's name is Garcia, and they have a mother and 2 daughters. Now, in my situation, my last name is Perthuis, and it was a father and 2 daughters. But my family looks very much like the Garcia family in this situation. However, remember that their experience might be common but it's not representative of the exact experience for everyone. So everybody's different. And as they say, if you've met one person with Alzheimer's, you've met one person. So Mary is a 73-year-old widow, and she lives alone. And she's a retired teacher who has always cared for her home meticulously. You know, her daughters might have even said she was a little OCD with this house. But recently, the daughter that lives close, so that's Lydia. Lydia lives close to her mother. She has begun to notice that the laundry piles up, there's junk mail everywhere, old newspapers scattered around the house. However, there's another daughter, and that daughter lives far away. She's the oldest, and she works long hours, and she's not able to visit with her mother very frequently. And she communicates, but she's with them through phone and text, but she's not there. She doesn't live there. Now, the daughter who lives close, Lydia, she's very concerned, and so she decides to reach out to her sister and tell her concerns. So again, a very typical text that goes first of, hey, I'm worried about her. She's probably okay, maybe not. Well, why don't we reach out to Dr. Salloway? And at this time, I'd like for us to listen to Dr. Stephen Salloway, who's a real person, even though the Garcias are fictional. Dr. Salloway is a real MD, and he's recognized as a leading expert in aging, Alzheimer's, and other memory disorders.
As we get older, cognitive problems become more noticeable for almost everybody, and it can vary from person to person. Typically with age, people have trouble coming up with the word they want right when they want it. They have trouble remembering names, and they don't think quite as quickly. What's more concerning, or what might be the beginning of a memory problem, is people have a lot of trouble coming up with words or names, and it's happening more frequently, and the words or names don't necessarily come to them later. And then they start misplacing things, but not just once in a while, because we all misplace things, but more often. And it begins to interfere day to day. That should be a warning sign for people that this might be the beginning of a memory problem.
So how many of you have had trouble with a name or have trouble with misplacing things and are worried? So we're going to tell you whether you should be worried or whether you shouldn't be worried. We're all here to learn about dementia and Alzheimer's and identify the common warning signs. So now you may have heard the words and the terms dementia and Alzheimer's used interchangeably. Now, they are related, but there are significant differences between the two terms, dementia and Alzheimer's. So now we're going to listen to another person that is Dr. Heather Snyder, and she's going to discuss exactly what dementia is.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow and the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
So remember, dementia is the umbrella, or as some people would term it, the spectrum is dementia. Alzheimer's is one of the diseases that is under the dementia umbrella. And in fact, it accounts for 80% of all cases of dementia. Now we're going to listen to Dr. Dean Hartley, and he's going to explain to us exactly what the disease is and what it looks like in our brain.
More than 100 years ago, Dr. Alice Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells or neurons throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
So I'm not sure if you know, but our brain only weighs about 3 pounds. But as it shrinks, it begins to weigh less. And so it's really important to know the signs of Alzheimer's. And now I'd like for us to listen to Ruth Drew, who's the Director of Information and Support Services at the Alzheimer's Association. And she's going to talk to us just a little bit about the importance of recognizing the warning signs of Alzheimer's.
It's important to know what the warning signs of Alzheimer's are and to be on the lookout. We know that we change over time, and the warning signs of Alzheimer's can be warning signs of a number of things. But when you see those in yourself or in someone you care about, it's important to check it out, to consult with a doctor, to find out what you're dealing with.
So one of the things we like to say is, when in doubt, check it out. And here you will see a list of the 10 warning signs of Alzheimer's. And some of them cross over each other, but we're going to go through these 10 signs. Remember, when in doubt, check it out. So the Alzheimer's Association, as a leader in this area, developed these list of 10 signs to help people understand. And this list is intended to be a tool, and it's going to help you identify these changes in thinking. It's important to note that this list does not constitute a diagnosis. They're simply the most common examples of changes that are experienced. And individuals may experience one or more of these signs, and they also may experience them in different degrees. So let's look at what each sign is and what some typical age-related changes can be. So let's look at memory loss. This is memory loss that disrupts daily life. So one of the most common signs of Alzheimer's is, especially early on, is forgetting recently learned information, short-term memory loss. Others include forgetting important dates or events, repeatedly asking the same question, and increasingly relying on memory aids or leaning on others for things or tasks once handled on their own. So turning to a person who's with you, a loved one, a spouse, a child, adult child, an aunt or an uncle or a friend, and saying, now, where were we going? Remind me again what we're doing. That's leaning on others. A typical age-related change is sometimes forgetting the information, but remembering it later. That's what happens with age. Our brain is saying, oh, I can't remember that, but it comes to us later. Maybe quickly later, or maybe later, or maybe after we go and we look and ask Mr. Google. Sometimes that's how I hear my friends and I come up with the things that we've forgotten in our older age. Another sign are the challenges in planning and solving problems. So some people may experience new difficulties in executive functioning, including developing or following a plan or difficulty concentrating. So that may be also being able to read or being able to figure out, how am I going to go to the store, or am I going to go to the store first or last in my list of errands? Now, more typical age-related changes are making occasional errors when managing bills or household finances. But more Alzheimer's warning signs are things that are much bigger than that. So we're going to listen to John, who is an actual person who lives with the dementia with Lewy bodies, about how he experienced the early warning signs.
I was probably spending 4 to 5 times more time preparing for something than I did, say, 5 or 10 years ago, because of I would lose my thought, I'd lose my focus, I'd get anxious, I wouldn't get to sleep. I was thinking I was in my sleep, I was thinking about what I was anxious about, which was what I was trying to remember, which was I was trying to prepare, which I was trying to do. So it was really a vicious circle of, so I was able to control it a lot, so that people wouldn't see things, and there weren't things to be seen. It's what was disturbing me was what effort I had to put into to do the things I used to do more easily.
The next sign that we have to talk about is the difficulty completing familiar tasks. People living with dementia often find it hard to complete daily tasks that used to be managed with ease, such as driving to a familiar place, making a grocery list, remembering how to play a favorite game. Conversely, again, on the age-related change, it could be that you occasionally need help using a microwave or a remote. You've got a new microwave, you have a new iPhone, you have a new cable system. Not knowing how to use those items is not necessarily a sign of dementia, but more age-related changes in the brain. It could include also having trouble with new technology that you haven't had the opportunity. So keep in mind that familiar tasks like cooking. We heard that that the Garcia family, that Mary was maybe not cooking as much and maybe couldn't organize her grocery list. So let's hear a little bit more.
Some people have difficulty with math or with reading in a way that's unusual to them. And once again, this is a change in that person. So for example, we all know somebody who was never able to balance their checkbook, right? So that wouldn't be a warning sign for them. But if somebody who always balanced their checkbook to the penny suddenly was paying bills, the same bill over and over, and not able to balance their finances, well, that would be a sign for them.
So an example that I use here of my own personal example is I had a very good friend who had been diagnosed with Alzheimer's, and she had been an accountant and a banker and a financial planner. And so she knew math, she knew numbers. But I went someplace with her one time, and there were 4 of us together, and we were buying tickets to a concert from a scalper. And the tickets, let's just say they were $10. They were probably much more. Let's say they were $100 for the ticket. And there were 4 of us. And so one person had paid the $400 for the tickets. And this friend who had this Alzheimer's disease couldn't figure out how much her ticket was. And that was a simple math problem. 400 divided by 4. It wasn't really difficult, but she could not figure that out. And so she would just say, you just tell me how much money that I owe you. That was her easy way of compensating and finding a way that maybe we wouldn't notice. So the 4th sign is confusion with time and place, or time or place. An individual that lives with Alzheimer's or other, they may lose track of the dates, the seasons, and the passage of time. They may have trouble understanding something if it's not currently happening, or become confused about where they are and how they got there. Now, there's a lot of us that may drive down the road and say, wait, how did I get this far? I didn't even see the store that I was going by. That's different from getting someplace and saying, how did I get here? Where am I? And how do I get home? It can become dramatic or profound in the middle to late stages of Alzheimer's. So again, a more typical age-related change could be that you're just confused about what day it is or when there's an appointment, but you figure it out later. A lot of people will laugh and say, you know what, I don't need to know what day it is. I'm retired. Every day is Saturday. But if you push them, they know what day it is. Warning signs of Alzheimer's may be that if you push them, they still don't know what day it is, or even how to figure out what day it is. The fifth warning sign of Alzheimer's is trouble understanding visual images and spatial relationships. So some individuals with Alzheimer's or other dementias may experience vision problems, which can lead to difficulty with balance, trouble reading, problems judging distance and determining the color and contrast, which can all impact driving or navigating the environment around them. They may have trouble with stairs or going up and down over a curb. Vision changes, such as cataracts, are more typical age-related changes and can also cause the same thing, the same balance issues and the same trouble driving and negotiating the environment around you. So this sign shows us that these changes are not just about memory. It's important to think about all the other ways that someone's daily life may be impacted by any of these changes. Let's hear from our expert again.
Alzheimer's disease is not just a disease of memory. It can affect other things too. It can affect the way that we perceive what we see. So sometimes somebody in the early stages of Alzheimer's might go to the eye doctor because they're having trouble seeing, and in fact, their vision is just fine, but the way they're perceiving what they're seeing may be difficult.
So we're halfway through the 10 warning signs. And number 6 is new problems with words in speaking or in writing. Individuals may have trouble following or joining a conversation. They may stop in the middle of a conversation and forget what they were talking about, and they may continuously repeat themselves. They might also struggle with finding the right word or calling things by the wrong name. They may start using more descriptive terms to talk about something rather than the name of the actual item. So they may say, put this over there in that thing, because they can't figure out any of the names along the way. Now, on the other side, a normal age-related change could be occasionally having trouble finding the right word. So let's hear from Phil, who also has Alzheimer's, and one of the warning signs that he noticed.
The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life, you know, as an avid reader, as a reporter, as a writer. I struggle with them now.
The 7th warning sign is misplacing things and losing the ability to retrace steps. This sign is one of the most common that causes concern in people. And I want to clarify that this is not about just losing your keys on occasion. Misplacing things from time to time, but retracing your steps to find them is a normal age-related change. How many of us have lost our keys? And maybe they were sitting right there where they always were. Or maybe they're in a really odd place. The difference is if those keys are in the refrigerator and you open the refrigerator, you find them and you don't know what they are. Not only do you not know how they get there, but you don't know what those things in the refrigerator are if they're your keys. A person with Alzheimer's disease may lose things and not be able to recall when it was last seen or identify the location where it was placed, or she or he may put them in unusual places. Putting your shoes in the refrigerator. Because of the lack of executive function and awareness, the person may grow increasingly suspicious of others and start accusing others of stealing. And they may do that more frequently over time. How many of us have heard our loved one say, look, I had this shirt and I think that the housekeeper stole it. I think that the aide stole it. I think our children stole it. I think you stole it. That is a very common warning sign with Alzheimer's.
So some people wonder if they lose their keys or their glasses or their purse, is that a sign of Alzheimer's? And One thing that I would say about that is for most of us, we might misplace something, but then if we retrace our steps, we can usually find it. We can usually remember. For a person with Alzheimer's, sometimes they're not able to retrace their steps. Sometimes that memory is just gone. And so when they do find their keys next to the phone because they got interrupted by a phone call when they were coming in, they set their keys down in an unusual space. So there they are next to the phone. If that happened to you or me, we'd probably remember, oh yeah, the phone was ringing when I came in the door. I put down my keys. The person with Alzheimer's might not remember. They might wonder who's moving their keys around because they never put their keys by the phone. So that's just a little bit of a difference in some of the dynamics with losing things in Alzheimer's.
Our eighth warning sign is decreased or poor judgment. Individuals may experience changes in judgment or decision-making, such as using poor judgment when dealing with money or paying less attention to hygiene and grooming. It can be especially common in individuals who are living alone. Once in a while, such as forgetting to get an oil change, is a more typical age-related change, or forgetting where you put that $20 bill. Let's hear from someone who has, again, diagnosis of Alzheimer's and what poor judgment she was making.
The way I kept my house, I wouldn't say I was OCD, but pretty close to it. And all of a sudden, everything was okay with me. It's like, oh, it's a pile, I'm tired. So my dining room table usually looked like it was someone's office because I always would say I would do it tomorrow. And then my bedroom, as far as clothing, I would just put it in a corner, put it in a chair. And all of this is just, I wouldn't say it looked like I was a pet wreck, but really I was because I never threw anything away. I always would say, I'll get to it, but I never did get to it. So just the way of my standard of living, it was actually decreasing.
So full disclosure, just so you know, I did this presentation a couple of days ago, and I immediately, when I finished, went into my bedroom and really started trying to clean things up because it was really a disaster, and I wanted to make sure that I didn't have these warning signs. So let's go to the next warning sign. So our ninth warning sign is withdrawal from work or social activities. So as we age, it's normal to feel uninterested by family or social engagements at times. However, someone who is experiencing dementia-related changes may start to lose their ability to hold or follow a conversation, and as a result, begin to withdraw from social encounters or hobbies. They may lose confidence to engage in that way. Now, sometimes people will withdraw from work or social activities because maybe they have trouble hearing. What we need to keep in mind is that people with hearing aids need to have their hearing aids checked and need to have the batteries changed on a regular basis, because not being able to hear can mask itself as being somebody who's withdrawing from hobbies and activities and maybe exhibiting signs of dementia, when really they just need some new batteries, or they need somebody to get on their case about putting in that hearing aid.
One of the most common changes and early on is the person's comfort zone shrinks a little bit, and then that gets worse throughout the course of the illness. So they're less comfortable going out, they're less motivated to do things than they were in the past. So there's some change in day-to-day functioning that way. I think people also lose confidence in their cognitive abilities, because they may not recognize someone or know their name or find the right word, and they'll feel awkward, and they don't want people to notice that, so they feel more comfortable at home or in situations with family where they're very, very comfortable with that wouldn't concern them. So people tend to withdraw a little bit and be less outgoing. That's can be one of the early signs of Alzheimer's.
Let's talk about our last warning sign that we have. The last warning sign is changes in mood and personality. Now that can go hand in hand with withdrawing from friends and hobbies. Individuals with Alzheimer's or dementia may become confused, suspicious, we heard about that before, depressed, fearful, or anxious. they may get easily upset at home or when they're out of their comfort zone. As we age, however, it's normal to develop very specific ways of doing things and becoming upset or irritable when our routine is disrupted. So again, normal aging, you still may be set in your ways, as they say. Whereas with dementia, it adds on to becoming confused and suspicious and depressed and fearful or anxious.
Another early sign of Alzheimer's or dementia is subtle changes in behavior. So all of a sudden, the family may notice the person is more easily irritated or more impatient or a little moody or have a shorter fuse or more anxious. Now, there's lots of things that can cause that, but often that can be an early symptom of Alzheimer's or go along with the early symptoms of memory loss.
Now that we've heard the warning signs and hopefully allayed some of your fears, either for yourself or your loved one, that maybe what you think is Alzheimer's is not, or at the same time have shown you that maybe some things you've been brushing under the rug may seem to look like Alzheimer's. So we've got two ways we could look at this. But let's go back and let's check and see what's going on with the Garcias. So remember, when we were talking about them earlier, the daughters were concerned about the changes they had observed in their mom. So they want to know when it's time to see a doctor about the changes and when they should have that conversation. So let's see what they had to say. So again, how do we know if it's serious enough? Well, let's see what Dr. Soloway has to say about when is the time to see a doctor.
Memory is not all or none, especially when there are early symptoms or signs. So on a good day, people might function very well and not really no one notices there's a memory problem. But on other days, especially if they're tired, then things become more noticeable. So memory is variable. It's not all or none. And then there are different type of symptoms that develop for each person. So some people may have trouble with language, may have trouble with organizing themselves, may have trouble navigating while driving, and other people don't have the same symptoms. So you don't have to have every symptom of Alzheimer's to be concerned. And I think the most important thing is determining what has changed from that person's normal level of functioning. And usually people have a pretty keen sense of, what they can normally do well. And then when either they or the family notice that there has been some change from that usual pattern of functioning, that should be a warning sign to people. But they don't have to check up all the boxes.
So that was a great recap from Soloway. So remember, these warning signs are intended to be a guide to help identify the problems in memory, thinking, or behavior that may be related to Alzheimer's or another dementia. As he mentioned, and as we've talked about earlier, individuals may experience one, all, or some of these signs in varying degrees and in numerous or single occurrences. They do not have to experience them all for there to be a concern. It's important to discuss any changes in memory, thinking, or behavior in either yourself or someone else with a doctor. The next thing we're going to talk about is early detection. It's key that we pay attention to what's going on with our own cognitive health and not dismiss any changes that we may be experiencing as normal aging, as well as that of others around us. Any change that's unusual for your level of functioning or that of someone around you is cause for concern. Many times, friends and family are the first to notice changes in someone's memory, behavior, and other abilities. In this next module, we're going to discuss why it's critical to address any observed changes early and seek answers from a medical professional. So, sometimes the person exhibiting the symptoms isn't even aware or might not have the insight to know what they are experiencing or why they're experiencing them. So it's really good to have an outside perspective. It's critical. This is especially important for individuals who live alone or far from family and friends. Again, we're going to go back to Dr. Salloway, and then we're going to hear from a care partner who was the first to notice changes in her husband.
It's a very interesting phenomena that people who have memory problems are often less aware of it than family members or their friends who know them well. One of the reasons for that is our ability to monitor ourselves, which is an important part of brain function, decreases when we start having memory problems. Not in everybody, but commonly, and more than half the people with memory problems. And so the person is just not keeping track of the trouble they're having day to day. But the family members are, paying attention. If they're paying attention, they see, boy, this is starting to happen a lot, and the person's not aware of it. So the family's more aware, and they may talk to their loved one about it, and they say, I've noticed you've been repeating yourself. And they say, I'm not repeating myself. And that could either be due to the fact that they're not aware of it, or they may not want to acknowledge it.
I was so adamant about what was happening to Daryl. I wasn't sure. I didn't know. And this wasn't the person that I know. This wasn't the person. Daryl was my husband was very, he always had to be building or designing or working with his hands. And it was getting to the point where he wasn't, and he was becoming very frustrated when he was forgetting to do things or go places.
What do you do if you notice someone who has some changes? If you continue to observe these changes, it's critical that you plan to take the next step and have a conversation with that person, or have a conversation with others that are close to him or her about what you've noticed. It can be a very difficult or uncomfortable conversation to have. The Alzheimer's Association has developed a roadmap of 10 helpful steps to help make addressing memory concerns a little less daunting and a lot more productive. So let's look at those 10 steps. Now, I think that these 10 steps looks like a game board that we would have, and it is important to have a game plan. So we're going to start by assessing the situation. What changes in memory, thinking, or behavior do you see? What is the person doing or not doing that causes concern? And some people, it'll be different what they see. So an example that I have, again, I was the daughter that lived far away from my father. And my sister was sending me the text that said, I think there's something going on with Dad. And I came to see him, and I went to dinner with him, and I didn't see any problems. And I talked to my sister, and I said, I don't know what you're talking about. He seems fine. She said, well, what did he order? Where did you go? And I said, we went to dinner at a Mexican food restaurant. And what did he order? And I said, well, he ordered tacos. She said, he doesn't really like tacos. And I said, well, he enjoyed his tacos. And she said, well, what did you order? And I said, I ordered tacos too. And she then said, who ordered first? I said, well, I ordered my tacos. And then Dad said, I'll have what she's having. And my sister said, that's because he can't read a menu. But for me, who didn't see him very often, I didn't pick up on that until another person pointed that out to me. What else is going on? Various conditions can cause changes in memory, thinking, and behavior. We want to watch out and see, are there other health issues or lifestyle issues that can be contributing to these changes? Is there stress? Is there a missing hearing aid battery? Is there a new medication that's in the pill box that we don't know what those side effects may be? You're taking the first steps right now to learn about the signs and the benefits of early diagnosis. So this is important. But now you want to say, did I notice any of these changes that we've just seen earlier in the 10 warning signs? Have I seen any of those changes in the person that I love and that I'm concerned about? Talk to your friends. and family, has anyone else noticed the changes? If so, what changes did they notice? Then have the conversation. Now, the conversations can be and usually is a difficult conversation. So you have to prepare and you have to plan. You want to figure out who should be the one who's going to discuss the concerns. Maybe it's one person, maybe it's multiple people. It could be a trusted family member, it could be you, it could be a friend, it could be a combination. It's usually best to speak one-on-one so that the person doesn't feel threatened or ambushed. And use what you know about the person to judge what approach might work best. Don't go all the way from 0 to 60 with, you've done these things, I think you have Alzheimer's, and you should go and move someplace into a memory care unit. Take it one step at a time. So like we said, who should have the conversation? When is the best time and place to have a conversation? It's important that you have the beginning of a conversation as soon as possible. But in identifying a date and time, again, remember to think about where they will feel the most comfortable. Do they feel the most comfortable in a situation where they're sitting side by side with you, where they're not having to look you in the eye? Are they more comfortable in a dining situation? Are they more comfortable at home? Make sure that you think about those the way you're the most comfortable about having a conversation. Are you hungry? Is it noisy? Are you tired? Make sure that everything around this conversation is the best that it can be. What will you or the person having the conversation say? You need to plan out a script and consider some of the following questions. I've noticed that you have not been able to cook lately because you haven't been able to follow a recipe, or it seems like you haven't been able to follow a recipe. I'm concerned. Have you noticed this? Are you worried about this? How have you been feeling lately? You really haven't seemed like yourself. Or maybe, I noticed that you haven't bathed in the past week. That doesn't really seem like you. It worries me. Is there anything else that you can tell me? Is there a reason why you think that might be happening? Now, when I had the bathing conversation with my father, he said, well, I bathed yesterday. You just weren't around when I bathed. Or if I would say, you know, you had those clothes on yesterday and the day before. I like these clothes. Your mother bought them for me and I want to wear them. He always had a way of answering that question. And a lot of people with Alzheimer's do have a way of trying to compensate for what's going on. You might offer to go with the person to the doctor. Ask the person to see a doctor and offer to go with them. Try to use some encouraging words like, there's lots of things that could be causing this. Why don't we go see a doctor? Or the sooner we know what's causing, the sooner we can address it. Or you could say, I think it would give us both a peace of mind if we talk to the doctor. Remember, you might have to have multiple conversations. Don't be discouraged if the first conversation is not as successful as you'd hoped. Write down some notes about how it went so you can prepare your script for the next conversation. Don't dismiss the changes you've noticed simply because the person is reluctant to address them or the conversation didn't quite go as planned. Last but not least, you need to reach out for support. And the best place, or one of the best places to reach out for support is to the Alzheimer's Association. We have a toll-free 24/7 helpline where you can talk to master's level clinicians who can provide reliable support and information, including about how to have this important conversation. And I guess really the last but not least is see a doctor. So most people address concerns about memory, thinking, and behavior with the primary care physician first. Now, in some cases, the primary care physician may refer the person to a specialist for further evaluation. Examples of specialists that they may refer you to could include a geriatrician who has additional training in medical care for diseases and conditions common to older adults over age 65. They might refer you to a neurologist who specializes in diseases of the brain, a neuropsychologist who can assess, diagnose, and treat psychological disorders associated with brain-based conditions, a psychiatrist who specializes in disorders that affect mood or the way the mind works, or maybe a psychologist that has specialized training in testing memory and other mental functions. We now know what the signs to look for and how to approach the conversation. So let's quickly talk about the benefits of early detection.
There are a number of benefits in early detection of Alzheimer's. For one thing, a person is able to have a voice in what happens next. They can make plans. They can live life more on their own terms. They can also make plans for the future, financial plans, care plans. They can let people know what they want, which can be a real gift later on. It also allows time for families to make plans and to make decisions about who can do what and figure out care and those kinds of issues. Also, the treatments that are available for Alzheimer's don't cure Alzheimer's. They don't slow down the disease, but they do help with symptoms. And it seems as though they tend to work better the earlier a person is able to use those. So that can help too. Some people are interested in clinical trials. Clinical trials allow people to have access to treatments that aren't available yet. And for some people, that can be a really important thing to pursue.
Seeking a diagnosis is very, very important. So we're going to look at what may be involved in the medical process to determine the cause of the symptoms. The first thing we're going to do is we are going to test our knowledge. So think about this. Is this true or false? There is currently no way to diagnose Alzheimer's disease. Well, the beauty of this statement is that this is false. Contrary to outdated belief that Alzheimer's diagnosis can only be made on autopsy, there are a number of assessments and tests that make it possible for healthcare professionals to diagnose Alzheimer's and dementia with a high degree of certainty. However, determining the cause can sometimes be much more difficult. So we're going to explore some of the possible steps in the diagnostic process. Keep in mind that as we review these steps, again, not everyone may be asked to undergo each one of these with their doctor. Assessments may include medical history, physical exam, a screen for depression, and an interview with close companions. Tests may include lab tests, mental cognitive status test, and brain imaging, PET scans, CAT scans. In Mary's case, they just did a few things. Do dementia-like symptoms always result in a diagnosis of Alzheimer's or other dementia? No, they don't. But Mary's daughters are waiting to see what the answers are about their mother.
Someone could have high blood pressure that's out of control, or they might have a thyroid condition that's not regulated, or diabetes that's not right, or on a medication that actually can cause memory loss. Drinking too much alcohol can make memory worse. So there are a lot of factors that go into cognitive difficulty with aging that some of them can be remedied. And so we want to do everything we can to improve cognitive ability and quality of life.
So as a quick review, remember that the diagnostic process is the same as anything else in this whole journey. It varies from person to person, and it depends on an individual's specific situation and what the doctor feels is the right course of action. It could be something other than Alzheimer's or another dementia, That's why it's important to go and get the test. Stigma and misconceptions about Alzheimer's, like that nothing can be done, can deter some people from seeking a diagnosis. But getting information and support is also a critical next step. So if the diagnosis is Alzheimer's, what's the next step? Let's see what Mary's daughters decided to do. So I'm going to end this presentation with a few slides about the Alzheimer's Association. The Alzheimer's Association is in communities across the country. The Alzheimer's Association also provides direct service to individuals and families, and our mission is to eliminate Alzheimer's disease through the advancement of research and to provide and enhance care and support for all of those affected, and to reduce the risk of dementia through the promotion of brain health. And our vision is a world without Alzheimer's disease. The Alzheimer's Association has a 24/7 helpline, and it is filled, again, and staffed by master's level clinicians and other very strong professionals. It provides access to highly trained and knowledgeable staff who can help with education, decision-making support, crisis assistance, and resource identification. These clinicians are available around the clock to provide in-depth care consultations, free of charge care navigation services that are offered to families at any stage of the disease, and help is available in more than 200 languages. Also is the website, alz.org. It's the first stop for individuals following a diagnosis of Alzheimer's. It includes selections specifically for people living with the disease and specifically for people who are caregivers. And then there's also a community resource finder. It's a wealth of community-based resources available in your area, including long-term care and community-based services, local association offices, and their offerings of programs. So make sure that you are visiting alz.org or alz.org/CRF. And if you want to get involved with the Alzheimer's Association, there's many ways to join the fight. You can volunteer, you can do advocacy, which is writing letters to your congressman, making phone calls. Trial match. Trial match is one of my favorite parts of the Alzheimer's Association. I'm involved in many trial match opportunities. It doesn't have to be just for people who have Alzheimer's. They need really healthy people there too, so that they can use people who don't have it to match up people who do. And one of my favorites is that I spend 45 minutes per year taking a test to just see how my memory's doing. There's also the Walk to End Alzheimer's. We're all very familiar with that, and it is a program that is very popular and very well regarded, and it's a way to raise money. There are other types of programs. There's another one called The Longest Day. And we know that as caregivers or people with Alzheimer's, it's a long day to take care of someone with Alzheimer's. So these are a number of ways that you can become involved. So now what I'd like to do is I'm going to stop sharing my screen. I'm going to go back to where we can look at each other and see if you have any questions. You know what I'll say to just wrap up here with Felicia is that this topic is huge and there's a lot of information. And so the way that Felicia and the Arlington have really pushed to do a number of different things in little bite-sized pieces allows you to learn it, to go away and kind of synthesize it and come back the next weekend. We're going to use these building blocks to build on, giving you more knowledge.
Great. Thank you so much.
Thank you. Thank you so much. We'll see you next week.
Absolutely. Thank you all. And so in the meantime, if anybody needs to get in touch with Cynthia, feel free to reach out to me, or you can reach out to Cynthia herself. Once again, I'm Felicia Saraceno. I'm the Director of Business Development here at the Arlington. My number is 239-307-3100. And Cynthia, what's the best way for them to get?
I'm going to put my information in the phone in here right now. I have a mobile phone that's a Texas mobile phone because I used to live there once upon a time. But I'm here in Southwest Florida, in beautiful, beautiful Southwest Florida. And I'll put my email address in here as well. Hey, you guys have a wonderful afternoon, okay?
Thank you.
And don't misplace your keys. If you misplace your keys, you're okay. Just don't put them in the refrigerator and forget them.
All right. Thank you. Thank you, everyone.
Bye-bye. Thanks, Felicia.
You're welcome.